So we'll quickly look at the Fitz-Hugh-Curtis Syndrome. So this is more of like a complication of it's more of a complication of what gonorrhea. Alright. So complication of gonorrhea, one of the characteristics is you have some things looking like guitar strings. Okay, you have some things looking like guitar strings. Alright, so let's quickly look at it. You see it, right? So it's a complication of what? Pelvic inflammatory disease. So they said that it's a rare complication of pelvic inflammatory disease. Okay, where I actually came across it the first time was pelvic inflammatory disease caused by what? Neisseria, gonorrhoeae. Do you understand? Alright, but it can actually be caused by some other things. But just so you know, there's inflammation around the endometrium. It could be along the fallopian tube. It could be along the ovary. You understand? And it usually causes what? Implication of liver capsule. Do you understand? And leads to adhesions between the liver and the abdominal wall or diaphragm. Now look at this. It's your liver that is up here, right? What is down here is the abdominal wall. Alright, so all these things you are having coming from the roof to the bottom, they are the adhesions that we are talking about. Alright, and it's pelvic inflammatory disease condition that is basically causing this complication. So the adhesions from the roof to the down is what is known as what looks like a violin string. Okay, it looks like the strings of a violin. So that's just what is known as what the Fitz-Hugh-Curtis Syndrome. So it's most commonly linked to what? Infections from Chlamydia, trachomatis, Neisseria, gonorrhea. Right. So bacteria are spreading from the pelvis via the peritoneal cavity, okay, and the lymphatic system and the bloodstream, right to implicate up to that region, okay, between the liver and the abdominal wall. So it occurs in about 5 to 15% of what women with pelvic inflammatory diseases. All right. So you see it. This is like a summary. So your liver is up there, your abdominal wall is down. So you have the adhesions forming between that. All right. So symptoms is what there's just a lot of pain in the right upper abdomen, and the pain often worsens when you move, when you try to cough, or when you breathe in deeply. So refer pain to the right shoulder of the arm. May also have fever, have fever, pelvic pain, vaginal discharge, right? Pain during intercourse, that's down there, okay? Then lower abdominal pain. So diagnosis is, of course, all these organs are buried in. So in as much as you have taken the medical history and physical examination, you are suspecting something, right? So you do pelvic examination, you test for what? Sexually transmitted diseases, right? To establish that Chlamydia, trachomatis was there, or Neisseria, gonorrhoeae. Ultrasound or CT scans will show you that there's inflammation. Laparoscopy is actually the gold standard, where you have to open up everywhere to look at it. A liver function tests are usually normal. Okay. Liver function tests are usually normal, slightly elevated. Treatment is what? Antibiotics, because you are basically dealing with all those infections from bacteria. So ceftriaxone, doxycycline, metronidazole. Then pain management. Then in rare cases, laparoscopy surgeries just to what? Remove these adhesions up. Alright. So that's what the Fitz-Hugh-Curtis Syndrome simply means. A complication of what? Pelvic inflammatory disease.